Today's drug is Carvedilol, brand name Coreg. The pharmacologic and therapeutic class is that it's an antihypertensive and a beta blocker with alpha blocking activity. Dosage form and strength. The medication comes as an extended release capsule in a 10 mg, 20 mg, 40 mg, and 80 mg strength. It also comes as a tablet in a 3.125 mg, 6.25 mg, 12.5 mg, and 25 mg strength. Indications and dosing for adults. The first indication is for hypertension. Regarding the immediate release tablet, the treatment range is between 6.25 and 25 mg by mouth twice daily. When initiating, start at 6.25 mg by mouth twice a day, with dose increases every 1 to 2 weeks, up to 12.5 mg by mouth twice daily. Then the final increase is up to 25 mg by mouth every day. The max dose is 50 mg per day. Regarding extended release tablets, the treatment range is between 20 and 80 mg by mouth every morning. When initiating, start at 20 mg by mouth every morning, with dose increases every 1 to 2 weeks, up to 40 mg by mouth every morning, then 80 mg by mouth every morning. In regards to dosing from immediate release tablets to extended release tablets, the extended release capsule treatment range is between 20 and 80 mg by mouth every morning, with a max of 80 mg per day. In regards to dosing changes from immediate release tablet to extended release capsule, 6.125 mg per day of the immediate release tablet is equivalent to about 10 mg per day of the extended release capsule. Dose increases are still done every 1 to 2 weeks. Regarding elderly or patients at risk of hypotension, dizziness, and syncope, the conversion is 25 mg per day immediate release tablets to 20 mg per day of the extended release tablet. If the patient is at 50 mg per day of the immediate release tablet, switch to 40 mg per day of the extended release capsule. Dose increases are every 2 weeks. The next indication is for heart failure with reduced ejection fraction. Prior to treatment, minimize any fluid retention. Regarding the immediate release tablet, the treatment range is between 6.25 and 25 mg by mouth twice daily. When starting, initiate at 3.125 mg by mouth twice a day, with dose increases every 2 weeks, up to 6.25 mg by mouth twice daily, then to 12.5 mg by mouth twice daily, then up to 25 mg by mouth twice a day. The max dose is 50 mg per day. Unless greater than 85 kg, then the dose is 100 mg per day as the max. Regarding the extended release capsules, the treatment range is between 20 and 80 mg by mouth every morning. Initiate 10 mg by mouth every morning, with dose increases every 2 weeks to 20 mg by mouth every morning, then 40 mg by mouth every morning, then 80 mg by mouth every morning. The max is 80 mg by mouth every day. The next indication is for left ventricular dysfunction in post-myocardial infarction. Prior to treatment, once again, make sure to minimize fluid retention. Regarding the immediate release tablets, the treatment dose is 25 mg by mouth every day. Initiate 6.25 mg by mouth twice daily as soon as possible after the patient is stable. Dose increases are done every 3 to 10 days to 12.5 mg by mouth twice daily, then 25 mg by mouth twice a day. Regarding the extended release capsules, the treatment dose is 80 mg by mouth every morning. When starting, initiate 20 mg by mouth every morning as soon as possible after the patient is stable. Dose increases are done every 3 to 10 days, up to 40 mg by mouth every morning, then 80 mg by mouth every morning. If the patient is experiencing fluid retention, hypotension, and bradycardia, initiate the dose at 10 mg by mouth every morning instead of the 20 mg. Some off-label uses are for chronic stable angina, AFib aflutter, early and secondary prevention of MI, and primary variceal hemorrhage prophylaxis. These off-label indications are not discussed, so please refer to the most current literature. Indications and dosing for pediatrics. The main indication in pediatrics is off-label. It is for heart failure with reduced ejection fraction. For the age range between 1 and 23 months, the dosing is weight-based and the treatment range is 0.2 to 3 milligrams per kilogram per day by mouth divided 2 to 3 times daily. When initiating, start at 0.05 milligrams per kilogram per day divided 2 to 3 times daily. Dose increases are every 2 weeks with a max of 3 milligrams per kilogram per day. For the age range between 2 and 11 years of age, the weight-based treatment range is 0.2 to 2 milligrams per kilogram per day divided into 2 doses. When initiating, start at 0.05 milligrams per kilogram per day divided twice daily with dose increases every 2 weeks. The max dose is 2 milligrams per kilogram per day. The next age range is between 12 years of age and older. The weight-based treatment range is 0.2 to 1 milligram per kilogram per day by mouth divided twice daily. Initiate at 0.05 milligrams per kilogram per day divided twice a day. Dose increases are every 2 weeks with a max of 50 milligrams per day. Mechanism of action and pharmacology. Carvedilol is a selective alpha-1 adrenergic receptor antagonist. It is non-selective for beta-1 and beta-2 adrenergic receptor antagonism. It is a racemic mixture with no intrinsic sympathomimetic activity. Associated effects are a reduction in cardiac output and a reduction of tachycardia. There is also a decrease in peripheral and renal vascular resistance and a decrease in heart rate and systemic vascular resistance. Some additional benefits are vasodilation, decreased pulmonary capillary wedge pressure, decreased pulmonary artery pressure, decreased right atrial pressure, and increased stroke volume index. Carvedilol has extensive hepatic metabolism via the CYP2D6, 2C9, 3A4, 2C19, 1A2, and 2E1 pathways. There is extensive metabolite formation. The medication is excreted primarily in the feces. The half-life elimination in infants and children from 6 weeks to 3.5 years of age is around 2.2 hours. In children and adolescents up to 19 years of age, it is around 3.6 hours, and in adults, it is between 7 and 10 hours. The R isomer is between 5 to 9 hours, while the S isomer is between 7 and 10 hours. Carvedilol is 90% protein-bound to albumin. Special populations and considerations. When discontinuing therapy, taper the patient off over 1 to 2 weeks. Regarding the renally impaired, caution is advised. Plasma concentrations are to be between 40 to 50% higher in moderate to severe renal impairment. Regarding the hepatically impaired, avoid use. There is a 4 to 7-fold increase in concentrations in patients with severe hepatic impairment. In the elderly, there is a 50% increase in plasma levels. Regarding patients with heart failure, there is up to a 100% AUC and Cmax increase. In regards to pregnancy, it may be considered in patients with heart failure, otherwise, other agents are preferred. Beta blocker exposure may increase risk for bradycardia, hypoglycemia, and respiratory depression. In regards to lactation, a mother should consider an alternative. Side effects. Common side effects are dizziness, fatigue, nausea, vomiting, and diarrhea, weight gain, edema, angina, anemia, increases in ALT and AST liver enzymes, hypotension, and bradycardia. Some serious side effects are chronic heart failure, heart block, severe bradycardia, asthma and bronchospasm, SJS, SLE, leukopenia, and severe anemia. Drug interactions. Some considerations for drug interactions are CYP1A2, 2C9, and 2D6 substrates, any antihypertensive agents, bradycardia, and drugs that have glycemic effects. Some contraindicated drugs of note are albuterol, clonidine, acarbose, alogliptin, aspirin, azithromycin, and sotalol. Monitoring parameters: BUN and creatinine, blood glucose in diabetic patients, blood pressure, heart rate, as well as liver function tests. Patient counseling information. Carvedilol is approved to treat high blood pressure and heart failure. It is also used to improve chances of survival after heart attack and to prevent stroke, heart attacks, and kidney issues. It may take up to 1 to 2 weeks to get the full benefit. Extended release capsules may be opened but do not crush, chew, or dissolve the contents. Either the capsules or tablets are taken with food to avoid and minimize any orthostatic hypotension. A missed dose should be taken as soon as possible but skipped if almost time for the next dose.